Thank you so much, Brett, for the kind invitation. Thanks to ZAP and John Adler for the opportunity also to travel outside of Europe for first time since 2.5 years. So I have to get used to being in a plane for more than an hour or so, but I managed to be here. So what I'm going to talk to you today is actually, maybe the pointer, here it is, on maybe different motivation to do neuromodulation. So let me maybe start from a view of a neurophysiologist. So in the last couple of years and last decade maybe, we learned a lot about the cellular and molecular underpinnings of quite a few neurological and neuroimmunological disorders. But yet therapies aiming at resolving these molecular changes, being protein aggregates or neuron T-cell interactions, prove to be little effective. And maybe the point is, and I think we learned this also from the earlier talks today, is that there is a dissociation between the behavior and these initial effects. And our work in the lab is actually focusing maybe on a missing link, which is the neural network and its dysfunction. So we hypothesize that these network changes are both temporally and also regionally dissociated from these early effects. And they, of course, they cause aberrant behavior, but they can also, if you kind of restore these these networks, kind of mirror back to the initial cellular effects, be it about kind of modulating microglia effects also. So we think there's a good reason to kind of bring forward neuromodulation for actually in a cross-disease design. And indeed, if you look at these changes of the level of a single neuron, there's a lot of reasons why you want to kind of modulate neuronal activity, because also aberrant activity itself can be very detrimental for neuronal survival. Okay, but how do we do that? How do we modulate neuronal activity across scales and also across species? How do we make sense of our insight gained also in animal models? So first of all, the first thing that I guess we need is that we need to embed kind of circuit analysis with behavior. So this is an example. What we are doing, this is a mouse on a jet ball. The mouse can move freely. You can see here the velocity of the movement, and the mouse is being presented with visual stimuli. And you see here on the right side, this is the cortical microcircuit on the level of the visual cortex. This is calcium, 2-photon calcium imaging. And now we can directly relate here the activity state of neurons and of the local microcircuit to the behavior. And like this, guess we might be in the position actually to close the gap I have just been mentioned. So what we actually do is that we derive from that a fine-grained assessment of the microcircuit activity. What you see here is actually the time course of all the neurons in this field of view and its activity. So in red here, the so-called calcium transients associated with exponential firing. What is more, just recently, we implemented 3-photon imaging, and the important point why I present this data here in this consortium is that with 3-photon imaging, we now have a label-free imaging of vessel dynamics. And so we will be, if I'm able to start this video, no, not like this. We are able now also then to observe, then you have to believe me, actually neuronal activity here with a label-free vascular component. So this enables us to really dissociate effects on neuronal activity and, for example, effects on vasculature or blood-brain barrier disruptions. What is more, since the early days where Brett and I met, of course, I have an interest in applying optogenetics in terms of modulating circuit function. And I think the point here to do so-called 2-photon optical physiology is that to really further our understanding and what does it actually mean to the local circuitry if a few neurons are are kind of either ablated or changing its activity. So we can here stimulate individual neurons and then assess the effect on the local network. An aspect we already saw data from today is to use calcium photometry to kind of bridge the scales. And we have been using that since quite a few years, combining optical recordings and optogenetics. And maybe let me make a point here on the use of optogenetics. So I think we have to move towards this kind of optogenetics 2.0, where we do not only use optogenetics to kind of understand what a cell or a neuron could do or can do, but rather to mimic endogenous network activity. And these are a few attempts to do so. If you see here, this is a network activation caused by local optogenetic stimulation, by sensory stimulation and activation, which occurs spontaneously. So, and important to note that we kind of mix and match it in a way that we can really better understand physiological and pathological network function dysfunction. Of course, as Brett mentioned, I'm working primarily on animal models, but eventually what we want to do is we want to get a readout of early network changes, which is translatable to the clinic. And functional MRI is maybe the bridge, but maybe we can do a little bit better. And we combined here fMRI with these optical fiber photometry recordings. And the reason behind doing that is that we can now do the following. We have here the optical recordings of neuronal network activity. And we can now do the following. We can binarize these activity, and then we can actually do the following. We ask the, we need to ask the fMRI signal towards, and actually extract the component, which is very important. So this was actually just also to showcase you the kind of toolbox that we have. And allow me just 1 minute to show you why also looking at networks is important also for a disorder where at stages you might not want to see that it's important. So for example, if you look at MS, you see here between these relapses, these patients are not healthy at all. They experience fatigue and depression. So we use this photon imaging to kind of look at these data, and we see here in remission state actually quite a shift of network activity. And importantly for this is that we conducted the single dose intervention, and this may be the point why I think the intervention here needs to be durable. And what you see here is a one-time intervention can directly rebalance the neural activity. And this is important because maybe this tells you something about this intrinsic ability of the network to kind of rebound and rebalance itself. And this is also translatable to the clinic. So as we also see these kind of changes in network structure also in patients. After this kind of toolbox introduction, let me dive into the data that we obtained in this very fruitful collaboration between ZAP, Aarhus University, and my lab in Mainz, where we actually asked whether we can elucidate the neuromodulatory effect of focal radiomodulation. We did this in a Göttingen mini pig, where we can use actually clinically applicable radiation equipment. And we also, basically for the electrophysiology experiments, we kind of implanted here a small electrode. And at least in a subset of experiment, we could do this fully implantable. And if you wish, this is already a brain-computer interface, so you can not only record, but also stimulate. Here, these Göttingen mini pigs were treated actually with various doses of 40, 60, 80, and 100 gray with a collimator size of 7.5 millimeter. And we targeted, these were just healthy mini pigs, we targeted the visual cortex of these animals, and we placed the electrode as such that the shanks of the electrodes are both placed in kind of the center of the radiated lesions, but also extend towards the regions which are not, at least not primarily affected. And this is just a more close-up on what we record, so we can get really a fine-grained assessment of neuronal activity with 64 electrodes, which were then spanning the entire cortex. Here is a close-up of the pig cortex where we implanted these electrodes in. So what did we record? We recorded spontaneous activity, meaning here we could really identify action potentials here on all these different shanks. And we conducted the so-called visual evoked potentials. You know that, of course, from the clinic, where these patients, in this case it was, of course, pigs, presented with the visual stimuli, flashes of light, where now then there's a very stereotypical response, which is defined by kind of negative and positive peaks. And if we did this here to this peak, I hope you can appreciate here that also we can identify here this N1, or you can also refer to N75 and P1 or P100, and identify these responses to really elucidate the excitability of the system. So what did we find? The first finding is actually that the neuromodulatory effect were not dependent on the distance from the radiation center. So this was 6 months after radiation. So what we did not find is that we found, this points towards kind of a, at least local circuit-wide modulation happening after this time. And this same was true also if you look at the effects here. So again, here these are the different shanks, so different distance from the radiation center, and kind of the frequency of spontaneous activity, or here the latencies of these VEP peaks, does not depend on the distance of the probe. However, if you look at the shanks in total, what we actually did find is that at 40 gray, we found an increase in the activity, in the spontaneous firing activity, and we found a decrease in the latencies to the one peak. So this is actually this same effect. So a decrease of latency means actually also a higher excitability of the high excitability of the cortical regions. And whereas at higher doses, what you see here in the spontaneous activity kind of significantly breaks down like a switch of these parts.
Question. The P1 component of the VEP, do I understand correctly that means that not only a focus has been altered by the irradiation, but the visual circuit has been altered in some manner?
Yeah, so the VEP, or the latencies of these components, of course, depending on the efficacy of the entire pathway from the retina to the visual dynamic nuclei all the way up to the striate cortex. And if you wish, yeah, the kind of ability of the region to kind of decode visual afferents is kind of increased. It's faster. It's as these animals were completely healthy and they did not have any kind of retinal or optical nerve damage, it's highly likely that actually effect that we see is due to the local cortical irradiation. But of course, it means that we have really not a kind of very local, but really network modulating effect upon this local radiation.
This is 6 months post.
This is 6 months post radiation. That is important. This is here the sanity check histology, and important to note that at 40 gray, which is of course now the most important piece of data, because at 40 gray we see this inhibitory effect. we did not find significant apoptotic damage, also no effect of effects of myelin basic proteins, so no effect on myelization, no effect on glia as far as we can see. So where is this effect now coming from? How can we explain this kind of, I already said disinhibition. Say that because in addition, colleagues at the Bay Area conducted an assay involving human-induced pluripotent stem cells, a difficult word for a non-native speaker, but I made it. So these were plated and comprising of excitatory and inhibitory neurons and irradiated. And of course, they were not followed up by 6 months, but by 15 days. But what we found was actually pretty surprising that we looked here at excitatory and inhibitory neurons differentially. And what you can see here, that of course excitatory neurons survival is also affected, but particularly at low doses, you cannot directly compare the doses to the in vivo situation, of course, but here look at this curve here. There's no effect on the survival, almost no effect of excitatory neurons, but a significant drop in survivability of interneurons. So what we believe that this is really at low dose a disinhibitory effect due to the effect of a higher vulnerability of interneurons. And
when you say sensitive, you're referring to histological response or physiological response?
I mean, here this is the survivability, but I'm referring to the physiological response because we see a disinhibitory effect. But John, coming to your question, I mean, the last 2 slides allow me to kind of formalize our findings. So, and this also goes along with finding in the clinic that patients patients' behavior is rather maybe characterized by rather plateau phases, which are then and in these plateau phases, then you have a sudden kind of these patients feel better the next day or they feel worse, and we know we really conceptualize the reason why we see this kind of 6-month-long effect is that maybe what radiomodulation is doing is that we kind of push the local network out of a self-stabilizing attractor, kind of push the ball out of this crater of a local minimum, and then it reaches a different attractor state, and then it's again stable, right? So of course these whether interneurons are more susceptible or not, any cellular effect is long gone after 6 months, but the network effect persists, and that's maybe the key difference between radiomodulation compared to other neuromodulatory approaches, that here maybe we have the chance to make a robust push to the system, push to the system, and this then allows to regain a different and hopefully more physiological network state. And actually, with this, I would like to end. I'm very grateful to my lab. I'm very grateful to this very fruitful collaboration with ZAP and Aarhus, and thanks also to my funding sources and you for your time. Thanks.
We have time for a few questions.
Yeah.
May I lead off? Professor Stroh, you've shown the ability of focally delivered radiation to increase the spontaneous firing rate of neurons at an area receiving 40 gray. Would you care to speculate on what that means in terms of being able to change firing patterns within a context of a circuit?
I think it's important to note that we more and more believe, and this is what you also said in your opening statement, that we have a bound network. So I very much believe that this also, particularly the spontaneous activity, also is important for kind of replay of learned behavior. And of course, this will also impact kind of oscillatory activities and not only limited to the visual cortex, because I think other cortical areas, even also the prefrontal areas, are listening in. So that's why I think also looking at the spontaneous activity tells you a lot about the kind of circuit changes, even maybe more so as looking at the classical function of a cortical structure here, processing visual afferents.
If you were to repeat this experiment after 1 week or 48 hours,
yeah,
any notion of what you might find?
Of course, it's an excellent question. I would love to look at this longitudinal. I would say I would find the same. That's why I presented to you the MS story, because then we did a one-time TNF-alpha injection, and we found a long-lasting effect of the network. So I mean, I believe that you do a strong push in the scale. You know this way better than me. Maybe in the first days or weeks after radiation. And this is then stable, because I would not imagine that anything would happen from 1 month to 6 months.
Is Manesh here?
Yeah.
So Manesh, how does this work? What are we observing here?
Well, I think my suspicion is that there are underlying voltage channel changes that are causing electrophysiologic alterations that are just taking time to accumulate over a period of time, because it's taking over 6+ months. In part, it could...
No, we've only observed it in 6 months.
Correct.
He didn't say that we don't know that this
Exactly.
is...
In part, it could be when we observe. You know, if we change the observation time window, we might see it at different points in time. But I actually did have one question as well, if I may ask. In all of these neural network type of experiments, one of the things we don't know going in for any one given specific neural network is how much redundancy there is in the network. So in other words, if we are actually able to do neuromodulation at one nodal point, will it be sustained? Or will there be a bypass? And will that function be recovered? How do we analyze that in an animal model setting? Do we need to keep animals alive for a very long period of time?
So I think that's a very relevant question. Of course, there's redundancy. Maybe I would rather say there are different ways how the network can achieve a given task given to a network. And this is, for example, can be done by fMRI, and this is done, for example, if you look at mutation carriers of Alzheimer's familiar, they can solve a navigational task as healthy subjects, but they're using other pathways. So this is what I would suggest, that it's just a different network states, and of course it's a very plastic, the network is very plastic, but at the same time very robust. So there's an interest of the network not to flick around all the time, and my point is maybe we can take this to our advantage and just kind of do one shift, which is then drastically outlasting this initial treatment. And maybe redundancy is a word, but also plasticity is maybe another word, that the brain is so interconnected that it's kind of assigning then, after you change one node, then it's actually assigning a different state. Then the big question is now, how do we push it, when do we push it, and at which node do we kind of do the gain control?
I think we all have the same interest in the time chronology of events. We know from other experiments and we know from clinical experience that the cascade of events occurring after the radiosurgery are spreading over 2-3 years. I personally, based on this, doubt on the idea that everything would be similar 1 day after and 2 years after. So this would be of great interest to know how would be this observation later and earlier.
Yes, so I fully agree that we have to do the longitudinal assessment of how the network kind of evolves. My only point would be that at least what we now more and more learn is that there are discrete states in which the network can be. It's not a continuum of function. right? There has to be a stability of how we function. We are still the same person on the next day. So this is very obvious, but if you look at this also has to be true for these local circuitries. So sure, of course, this can evolve, and I can only speculate when this will, but I think there has to be a kind of limited number of different states. Now it's called cortical songs, or whatever you want to call it, and I think now we need to find out which cortical song it is that we want to play.
Thank you, Professor Stroh, for that